Immigrant and Refugee-Led Capacity Development Network of Illinois, IRL-CDN, CBO Spotlight, a partnership with University of Illinois Chicago, Institute on Disability and Human Development, and Illinois Department of Human Services, IDHS.
Cass County Department of Public Health.
Introductions.
My name is Audra Elam. I'm the Welcome Center Coordinator here at the Cass County Health Department.
What motivates you to serve your immigrant and refugee communities?
I think the simplest way to answer that question, it's a need. It's a huge need, especially in Cass County. We're such a rural area. Resources are already scarce, resources specific to immigrants and refugees. We're the only one, it's a huge need that I see every day in our community. And that's why I do it. That's why I stay here, because I want to build it up and I want to make it into a larger resource for our individuals here.
What is the most rewarding part of your work?
I think anyone who is in this line of work will say it's incredibly rewarding to have a happy ending to a particularly difficult case. I think we all experience that joy and that relief when we finally have a solution for somebody. But another really rewarding part of this job, especially being in a small town, I have a really unique point of view of how our community supports and encourages our immigrant community. For example, we had a really, really devastating fire in May. An entire apartment building went down. 13 individuals lost their homes. 10 of those 13 were immigrant individuals. And our, people from our community were just donating money, coming in, just everyday people. And again, we're rural. It's a very poor community already. And just from those individual donations, our community raised over $25,000 for those people. So being able to see that kind of from behind the scenes of just how many people came out and how those systems of community care are opening up for everyone in our community is very, very rewarding to see. And then, on top of that, just it's such an opportunity, it's such a privilege to be in this position and get to build relationships, get to know so many of these wonderful families. That's also just a huge reward in itself. So,
what makes the work of your organization unique?
The Cass County Welcome Center, I think, is very unique in comparison to all the organizations we've been meeting with over the past few months. A lot of those other organizations are in more populated areas or in Chicago. There's a lot of other resources around. Our Welcome Center is the only resource available in Cass County specific to immigrant and refugee individuals. And also with it being such a small town, Beardstown is 5,000 people. It's tiny. It affords a lot of boots on the ground kind of work. I get to know these families pretty well. I have families that will call me or call our office. Maybe they're in quarantine and they need something specific. Maybe they need a thermometer to monitor their care. I can just go pick up a thermometer and drop it off on their house on my way home. So that's very unique to be able to be very much involved on not just as a Welcome Center, but as a community member on top of that. And yeah, I think we're very unique in that aspect of just how tight knit everything and everyone is here.
With the challenges presented by COVID-19 regarding service delivery, how do you feel your organization has responded in terms of supporting its immigrant and refugee communities?
I think that's another thing that's very unique, is our Welcome Center, our grant for our Welcome Center came through the Cass County Health Department. So I'm an extension of the health department. I was trained in contact tracing. All throughout COVID, I had all of that information at my fingertips. And we were able to very much make sure everybody was getting the information they needed to stay healthy and stay safe throughout the pandemic, making sure that our vaccine outreach and accessibility was equitable. And I was directly involved with scheduling vaccine appointments for especially our French speakers and our Spanish speakers, scheduling COVID tests. I again was trained in contact tracing. So I did a lot of contact tracing interviews for our immigrant individuals. And then on top of that, I was able to kind of go into my own assessments of, okay, do we need food in the house? Do we need toiletries? During your time of quarantine, how are we going to get this to you? So yeah, I feel like throughout COVID, our Welcome Center very much took on a role of like, okay, we're going to be COVID aid specifically to the immigrant community, which is now, dialing back a little bit. But as far as operations went, nothing slowed down. In fact, I feel like there were weeks where it really sped up because we had so many families in quarantine and helping to monitor those families and their symptoms and making sure that everybody was getting the medical care that they needed. We also had a emergency financial grant here, financial assistance grant here at the health department. So I got to be directly involved with that. If I was speaking to a family, they said, oh, dad lost his job due to COVID. Well, hey, I know of this program. So being a part of the health department, being an extension really of the health department, really ensured that our operations as a Welcome Center was very much intertwined with COVID education, COVID health, and making sure that all families that were affected by COVID were getting the resources that they need.
Please share an overview of the immigrant and refugee communities you serve.
I actually have been putting together a little training for the health department as a whole on the basic demographics. That way, all of our service providers are aware of who all are we serving in this community. And in my research for that training, we have in this tiny county the county itself, I think, is only 12,000 people. We have 34 different nationalities here. And that's there's a lot of factory work in this area, and that's what draws a lot of people here. But our biggest communities, so we have our Spanish speaking community, and we have a lot of people from Mexico. We have a very big Dominican population, Cuban, Honduran, El Salvador, Guatemala. We have a handful of individuals from Colombia, Bolivia, Nicaragua as well. Our African community has really started booming here since the early 2000s. Our biggest communities are Congolese families. And then we also have Togolese families from West Africa. We have Senegalese. We have people from Guinea. We have people from Burkina Faso. We have people from Liberia, really all over the continent. And in the last 5 years, we've been getting a large population from Myanmar, a large Burmese population. We also have a handful of individuals from Laos, from the Philippines, from Vietnam, from India. But our biggest populations, as far as Spanish speaking individuals, are those from Mexico, Our French-speaking individuals are those from the Congo, Democratic Republic of Congo, Republic of Congo, or Togo, and then our from our Asian population, mostly Burmese individuals. So it's an array of languages, of cultures, and that's another thing I just think is really cool, because where else can you find a tiny sleepy little town, and then you're walking down the street and you're going to hear people speaking Ewe, you're going to hear Lingala, you're going to hear Burmese, you're going to hear Spanish. It's really cool.